Hello everyone. Yes, this is the Chief.Prof.Med.Dr Richteranwanlt Beauty Princess Prestige Osanodazie OGBEBOR, Paracologist, MDGP. God bless you. So today I will be talking about blood. All right, what is blood? Symptoms of blood, causes of blood, risk factors, and so on and so forth. Thank you very much. Okay, now we get it started. Blood in urine, hematuria. All right. Now, seeing blood in your urine can be alarming, while in many instances, the cause is harmless. Blood in urine, hematuria, can indicate a serious disorder. Blood that you can see is called gross hematuria. Urine blood that is visible only under a microscope. Microscopy hematuria is found when your doctor tests your urine. Either way, it is important to determine the reason for the bleeding. Okay, so we look into the symptoms. Now, before we look into the symptom, let's see what is blood. Okay, what is blood? Okay. Now, what is blood? Blood is essential to life. Blood circulates through our body and delivers essential substances like oxygen and nutrients to the body cell. It also transports metabolic waste products away from those same cells. There is no substitute for blood. It cannot be made or manufactured. Generous blood, excuse me. Okay. Yeah, this is body nourishment. Okay, so good. All right. Okay, we continue. So it cannot be made or manufactured. Generous blood donors are the only source of blood for patients in need of a blood transfusion. Okay, so that is it. That is the meaning of blood. Now we go back to where we are, the symptoms of blood. the symptoms of blood. Now, gross hematuria produce pink, red, or cola color urine due to the presence of red blood cells. Okay, it takes little blood to produce red urine, and the bleeding usually isn't painful. Passing blood clots in your urine, however, can be painful. Now, causes. Okay, in hematuria, your kidney or other parts of your urinary tract allow blood cells to leak into urine. Various problems can cause this leakage, including urinary tract infection. This occurs when bacteria enter your body through the urethra and multiply in your bladder. Symptoms can include a persistent urge to urinate, pain and burning with urination, and extremely strong smelly urine. Now, for some people, especially older adults, the only signs of illness might be microscopic blood in the urine. Okay. Now, kidney infection. This can occur with bacteria enter your kidney from your bloodstreams or move from your ureters to your kidney. Signs and symptoms are often similar to bladder infection, though kidney infections are made likely to cause a fever and frequent pain. Now, a bladder or kidney stone. The minerals is concentrated urine sometimes form crystals on the walls of your kidney or bladder. Over time, the crystals can become small, hard stones. The stones are generally painless, so you probably wouldn't know you have them unless they cause a blockage or are being passed. Then there is usually no mistaking the symptoms. Kidney stones especially can cause excruciating pain. Bladder or kidney stones can also cause both gross and microscopic bleeding. Now, enlarged prostate. The prostate gland, which is just below the bladder and surrounding the top part of the urethra, often enlarge as men approach middle age. It then comprises the urethra, partially blocking urine flow. Signs and symptoms of an enlarged prostate: bench prostatic, hyperplasia, or BPG. BPH includes difficulty urinating, an urgent or persistent need to urinate, and either visible or microscopic blood in the urine. Infections of the prostatitis can cause the same signs and symptoms. Okay, now we look into the kidney disease. All right. So, microscopic urinary bleeding is a common symptom of glomerulonephritis, an inflammation of the kidney filtering system. Glomerulonephritis can be part of a systemic disease such as diabetes, or it can occur on its own, viral or strep infections, blood vessels disease, vasculitis, and immune problems such as IgA nephropathy, which affects the small capillaries that filters blood in the kidneys. Glomeruli can trigger glomerulonephritis. All right. Now, cancer. Visible urinary bleeding may be a sign of advanced kidney, bladder or prostate cancer. Unfortunately, you may not have signs or symptoms in the early stage when these cancers are more treatable. Now, inherited disorder. So we look into that, okay? Sickle cell anemia, an hereditary defect or hemoglobin in red blood cells, causes blood in urine, both visible and microscopic hematuria. So can Apert syndrome, which affect the filtering membrane in the clemoring of the kidneys. Now, kidney injury, a blow or other injury to your kidney from an accident or contact spots can cause visible blood in your urine, okay? Medication, all right? Medication, the anti-cancer drug cyclophosphamide and penicillin can cause urinary bleeding. Visible urinary blood sometimes occur if you take an anticoagulant such as aspirin and the blood thinner heparin, and you also have a condition that causes your bladder to bleed. Now, strenuous exercise. Strenuous exercise. It is rare for strenuous exercise to lead to gross hematuria, and the cause is unknown. It may be linked to trauma to the bladder, dehydration, or the breakdown of red blood cells that occur with substance aerobic exercise. Now, runners are most often affected, although anyone can develop visible urinary bladder bleeding after an intense workout. If you see blood in your urine after exercise, don't assume it's from exercising. See your doctor, okay? So we look into the risk factors. Yeah. No, the risk factors. 1. Age. Many men older than 50 have unconditional, occasionally hematuria due to an enlarged prostate gland. Now, a recent infection, kidney inflammation after a viral or bacterial infection, post-infectious glomerulonephritis is one of the leading causes of visible urinary blood in children. Now, family history. You might be more prone to urinary bleeding if you have a family history of kidney disease or kidney stones. Certain medication, aspirin, non-steroids, anti-inflammatory, pain reliever, and antibiotics such as penicillin are known to increase the risk of urinary bleeding. Now, strenuous exercise. Long-distance runners are especially prone to exercise indoors urinary bleeding. In fact, the condition is sometimes called joggers hematuria, but anyone who works out strenuously can develop symptoms. Okay, so we look into the diagnosis and treatment. Okay. Now, the following tests are examined played a key role in finding a cause for blood in your urine. Physical exam, which include a discussion of your medical history. Urine test. Even if your bleeding was discovered through urine testing, urinary analysis, you're likely to have another test to see if your urine still contains red blood cell. A urinalysis can also check for a urinary tract infection or the presence of minerals that cause kidney stones. Now, imaging test. Often an imaging test is required to find the cause of hematuria. Your doctor might recommend a CT or MRI scans or an ultrasound exam. Now, stethoscopy. Your doctor trains a narrow tube fitted with a tiny camera into your bladder to examine the bladder and urethra for signs of disease. Alright, so sometimes the cause of urinary bleeding can be found. In that case, your doctor may recommend regular follow-up tests, especially if you have risk factors for bladder cancer, such as smoking, exposure to environmental toxins, or a history of radiation therapy. Alright, so that is it. Now, treatment. We look into treatment. Now, depending on the condition causing your hematuria, treatment may involve taking antibiotics to clear urinary tract infection, trying a prescription medications to shrink and enlarge protest, or having shock wave therapy to break up bladder or kidney stones. In some cases, no treatment is necessary. Okay, so now what you can do, your symptoms, key medical information or medications, vitamin or other supplements. Okay, all right. What to expect from your doctor? Do you have pain when you urinate? Do you see blood in your urine only sometimes or all the time? When do you see blood in your urine? When you start urinating towards the end of your urine strength or the entire time you are urinating? Now, are you also passing blood clots during urination? What size and shape are they? Do you smoke? Are you exposed to chemicals on the job? What kinds? Now, have you had radiation therapy? So these are the questions your doctors will ask you, you know. Okay. All right, this is it. Okay. All right, this is it for today. Thank you very much. I remain your humble doctor. Yes, your family doctor. Chief Medical Doctor. Yes. Prestige. God bless you and bye for now. All right.